Dear students, welcome back. In the previous session, we have discussed about bony parts of the femur. Now in this session, we are going to discuss about the attachments on femur, both muscular attachments as well as the ligaments which are attached to the bone. So in the previous session, we have discussed the bone in the form of a side determination and the anatomical position, and also we have divided the bone into upper end, shaft and the lower end. Okay, and we have seen the parts of upper end, shaft and the lower end, and also its borders and surfaces. Everything we have discussed in the previous session. Now in this session, so what are the muscles which are getting originating or inserted from these bony parts? Okay, yes. Now we will see the upper end of the femur. So we are going to consider upper end of the femur, both the anterior aspect as well as the posterior aspect. Okay, yes, here the head. So upper end will have, what are the parts? Upper end will have head, okay, neck, and then greater trochanter, lesser trochanter, isn't it? And also we know that there is a line called as intertrochanteric line is present, which connects the trochanters. Okay, so on this same as on the posterior, it is having a crest there. Intertrochanteric crest is present on the posterior aspect. Okay, yes. Now we will see what are the muscles attached in these areas. So if you take the head, so head will have a pit, isn't it? So that pit is called as fovea. Okay, so this fovea, from this fovea a ligament is attached called as ligamentum teres. Ligamentum teres is attached. Okay, and also on the anterior surface of the head, at its inferior-medial, it is related to femoral artery. So this one is related to here femoral artery. Okay, so here we can see these are the things related to the head. If you come to the neck, here only capsular attachment is seen. So capsule of hip joint is seen. Okay, that means the neck is present in intracapsular. Okay, yes. So the anterior surface of the neck is completely present inside the capsule only. And if you see the posterior, so the capsule extends to just more than medial half of the neck. Not completely, only greater than medial half of the neck is covered by capsule on the posterior aspect. Okay, this is about capsule. So if you see the head, what is the ligament attached at the fovea? Ligamentum teres. Okay, at the inferior medial part, the femoral artery is related to the head of the femur. And then if you come to neck, so what is the thing attached here? So capsule of the hip joint is present. So on the anterior aspect, the entire neck is inside the capsule. Okay, if you come to the posterior, the capsule covers more than medial half of the neck. Okay, so we have finished head and neck. Now we will move on to greater trochanter and lesser trochanter, and the remaining thing is the intertrochanteric line, and on the posterior aspect we will have intertrochanteric crest. So now we will see what are the muscles which are attached on the greater trochanter. Okay, here normally this greater trochanter receives muscles. That means insertion of the hip muscles is going to take place. So this is present on the lateral aspect, this greater trochanter. So if you observe what are the lateral side muscles on the hip, isn't it? So from the ilium, what are the lateral side muscles? So gluteus minimus is the major muscle which is present on the medial, that is lateral aspect of the ilium, isn't it? So that muscle is going to get inserted here on the anterior surface. So normally this greater trochanter is having a ridge, oblique ridge. I have already shown you. On the oblique ridge, this gluteus medius muscle is getting inserted, and it is also having a superior border. On the superior border, the piriformis muscle is getting attached. Okay, that means two muscles are inserted on the greater trochanter. Okay, if you see on the posterior aspect, okay, if you see on the posterior aspect, on the medial surface, okay, on the medial surface of the greater trochanter, so you will find three muscles are getting inserted by a common tendon. One is the obturator internus and superior and inferior gemelli. So these are the three muscles which are getting inserted on the medial surface of the greater trochanter, especially at the posterior inferior part of the greater trochanter. Okay, and then so coming to again on the anterior side, so now we'll see at the lesser trochanter. At the lesser trochanter, on the lesser trochanter, iliopsoas muscle is getting inserted. If you differentiate into two muscles, psoas major and iliacus is getting inserted. Okay, psoas major. So if you make into this thing, so it is almost all in a triangular projection. So the medial part, it gives insertion to the psoas major, and then the iliacus at the base of the lesser trochanter. The two anterior surface of the lesser trochanter. So some of the fibers we can see on the posterior aspect also, psoas major and iliacus. So these are the muscles inserted on the upper end of the femur. And now we'll see the intertrochanteric line. This intertrochanteric line gives origin to two muscles and attachment to two ligaments. Okay, two ligaments and two muscles are getting inserted here, originating here. So what are the muscles which are getting originating? So if you see along the intertrochanteric line, so we can find along the intertrochanteric line we'll have the attachment of capsular ligament of the hip joint. Okay, yes, and then you'll have the attachment of upper band of iliofemoral ligament and attachment of a lower band of iliofemoral ligament in its lower part. So here you can see very clearly in this pic here. Yes, so if you see this iliofemoral ligament, so this one is having two parts. One is upper part, okay, and another one is the lower part. Okay, this one is the intertrochanteric line here. Yes, this is the intertrochanteric line. So this upper band of the iliofemoral ligament is attached in its upper part, okay, and the lower part, that is lower band of iliofemoral ligament, is getting attached in the lower part. Okay, so this is the attachment of iliofemoral ligaments along the intertrochanteric line. Now we will see what are the two muscles which are originating there. Okay, so in the upper end, so below the upper or we can call it as from the upper part of the line, the muscle is originating is the vastus lateralis. At the lower part, vastus medialis is originating. Okay, so on the anterior aspect we have seen that, so hip joint capsular ligament, okay, or capsule of hip joint, both are same. And on the greater trochanter, on the anterior aspect, gluteus minimus and piriformis, and along the line upper part it gives attachment to the vastus lateralis and the lower side vastus medialis. Okay, and iliofemoral ligaments are also attached to along the intertrochanteric line. If you see on the posterior aspect, so a quadrate tubercle is present along the intertrochanteric crest, which receives the insertion of the quadratus femoris. So quadratus femoris is getting inserted here. So this one is has given in blue color. It is not blue, actually it is actually it is not red in color. So this one is blue in color. Okay, yes. So insertion of the quadratus femoris is taking place here. Okay, and this is all about the attachments on the upper end of the femur. Okay, now we will move on to the shaft of the femur. So if you see the muscles which are attached on the anterior aspect of the shaft, okay, so the vastus intermedius arises from the upper 3/4 of the anterior and lateral surfaces. So this is the vastus intermedius muscle, which is originating from upper 3/4. Okay, and next one below this, just below this vastus intermedius, a muscle called as articularis genu arises below this vastus intermedius. Okay, so and also lower 5 centimeters of the anterior surface are related to suprapatellar bursa, which is related. Okay, these are the things which are attached on the anterior aspect of the femur. Okay, if you see at the lower end of the femur also, you'll find a capsular attachment of the knee joint along the intercondylar line. Okay, next, if you see on the posterior aspect, so in the posterior aspect, it is normally we have seen that upper part of the shaft is having 4 surfaces, isn't it? And here the muscles which are attached in the upper posterior of the shaft, if you can see upper posterior part of the shaft, the muscles attached from lateral to medial, so here the muscles are, if you see from lateral to medial, the muscles are gluteus maximus muscle. Why? Because here we can have the gluteal tuberosity, so this is the gluteus maximus muscle. And then medial to this one, you'll have adductor magnus and then adductor brevis. Next goes to pectineus, next iliacus and psoas major. So in the upper posterior, the muscles attached are gluteus maximus and then adductor magnus, adductor brevis, pectineus, iliacus and psoas iliacus and vastus medialis, not psoas muscle, vastus medialis muscle is related. Okay, so these are the muscles on the upper posterior part. Okay, so if you see the muscles on the lateral aspect along the shaft, you'll have the vastus intermedius, because this muscle is originating from anterolateral surface, so we can find the vastus intermedius on the lateral aspect also. So here this is the attachments on the posterior surface, that is along the linea aspera. So many muscles are getting attached here. So this one we are going to see in a magnified form. Yes, so what are the muscles which are getting attached here? Okay, so this is the magnified view of structures which are attached to the linea aspera. Okay, so from lateral to medial, again we will see the what are the muscles which are attached here. So vastus intermedius, okay, and then which is followed by, so here the septa are present. One is lateral intermuscular septum, okay, and on the medial side you can find medial intermuscular septum, which is represented on the green line. Okay, yes, and also posterior intermuscular septum. So if you see the muscles from lateral to lateral intermuscular septum, there are two muscles which are attached, or vastus intermedius and some part of vastus lateralis muscle, vastus intermedius and vastus lateralis muscle. Okay, then you will find the lateral intermuscular septum. Afterwards, short head of biceps. This is one of the hamstring muscle. Okay, short head of biceps. Again we will find the posterior intermuscular septum. Afterwards we can find the adductor magnus. Okay, adductor magnus, and then adductor brevis, which is seen only on the upper aspect of the shaft, adductor brevis, and then adductor longus. Again we will find the medial intermuscular septum, and finally vastus medialis. So these are the muscles attached from lateral to medial in the related to linea aspera. Okay, now we will move on to lower end on the lateral aspect. So on the lateral aspect, the muscles which are attached is the lateral head of the gastrocnemius muscle, and also fibular collateral ligament is attached. Again we can find the capsular ligament of the knee joint, and here a groove or tendon of popliteus, that is popliteus muscle, is getting attached on the lateral aspect, that is lateral condyle. Okay, the fibular collateral ligament is attached to the lateral epicondyle. Okay, and a muscular impression near the lateral epicondyle is giving attachment to the lateral head of gastrocnemius. Okay, and the popliteus arises from the deep anterior part of the popliteal groove. Okay, now if you see the attachments on the medial condyle, so here we'll see the medial condyle. What are the attachments on the medial condyle? The medial condyle is giving attachment to the what you call as tibial collateral ligament. Okay, and you can find the adductor tubercle. So the adductor tubercle, which is here, actually this one is the adductor tubercle, which gives attachment or receives insertion of the hamstring part or the ischial head of adductor magnus. Okay, the adductor magnus is getting attached there. Okay, if you see the attachments on the intercondylar notch, here in the notch, what are the attachments you'll find here is the anterior cruciate ligament and posterior cruciate ligament, and intercondylar line provides the capsular ligament. So this one is the capsular ligament here. Okay, next this intercondylar line provides attachment to the capsular ligament as well, and laterally to the oblique popliteal ligament. So simply capsule of the knee is attached over there. Okay, and then here you can see the anterior cruciate ligament and posterior cruciate ligament, which is attached in the intertrochanteric fossa. Intercondylar fossa. Okay, so here the anterior cruciate ligament is located on the medial side of the lateral condyle, whereas the posterior condyle is attached to the lateral surface of the medial condyle. So these are the attachments. At the intercondylar fossa. Now we'll move on to the ossification of the femur. Okay, so the femur ossifies from one primary center and 4 secondary center. Okay, this primary center appears at the 7th week of intrauterine life, and the remaining 4 secondary centers appear, one for the lower end. Okay, one for the lower end appears at the 9th month of intrauterine life and fused by 20th year. Okay, and next one is for lesser trochanter, secondary center for lesser trochanter appears at the 12th year and fused at 18th year, and another secondary center, that is the 3rd secondary center for the head, which is appeared at the 1st year and fused by 18th year, and secondary, the last 4th secondary center, which appears for greater trochanter, appears by 4th year and fused by 18th year. So these are all the and also the lower epiphysis fused by 20th year completely. Okay, so these are the ossification centers of the femur, and ossification of the lower end of the femur is of medical legal importance. Okay, and the lower end of the femur is the growing end of this bone. So these are all the attachments and ossification of the femur. In the next session we are going to discuss about patella. Thank you.